my name is Lisa Madeline. I'm a family nurse practitioner with the 45 Urgent Care here in Jackson. Today I want to talk about your thyroid. The thyroid gland is a gland in your neck, right in this area here. It's a butterfly shaped, and it actually produces hormones that's very important to your body. It helps do a lot of things in the body, but one of the most important things it does is it helps to regulate metabolism and helps with your digestion and helps give you energy. So if you're low of energy, not having a lot of energy, real fatigued a lot, then you may need a check on your thyroid. But back to what the thyroid actually does, it produces two hormones. One is called T4 and the other one is T3. T4 actually works in a feedback mechanism loop. It goes to your brain to another gland called the pituitary gland, and it's kind of like a temperature gauge that tells the pituitary or the thyroid whether or not it's producing the right amount of hormones for your body. But the T4 then has to be converted to T3 in the body for it to actually do its work and give us energy and regulate our metabolism. And in order to do that, you have to have iodine. So iodine is really important. If you're not getting iodine in your diet, then you need a supplement in your diet or in your regimen to help the T4 convert to T3 so it can actually be used. There are some specific types of symptoms of low thyroid, including just kind of feeling cold all the time, never can get warm. Sometimes that is just in the form of, I feel fine everywhere else, but my feet always stay cold. And if your feet and hands are always cold, then that may be a sign. Chronic fatigue or just never feeling like you're getting enough rest is another sign. Dry skin, dry brittle hair is another sign. Sometimes people's hair tend to fall out and get real thin when their thyroid begins to get low. And everybody's thyroid does begin to get low at some point in their life as they age. It's kind of like all of our other hormones. We know about menopause and how women go through menopause because they lose their estrogen. Well, we lose our thyroid function as well. And that needs to be treated for your body to work properly. So it's just a normal or a standard blood test is all it takes to get it checked, and it can be done with a simple stick to check your thyroid. It checks three things: your TSH, which is your thyroid stimulating hormone from the pituitary, to T4, and then the free T3, and then we can get a pretty good idea of how your thyroid is functioning. So if you're having these symptoms, come on into 45 Urgent Care and see me, and we'll see what we can do to get your thyroid fixed. Thanks.